warm welcome. Thanks for tuning in to another one of those webinar sessions where we talk about Samajhdar Bano Sehat Ke Ishare Samjho. This is the CSR initiative by USW. We're talking about halting our heart ailments. Just a couple of days back, on the 8th of March, we celebrated the International Women's Day. But this year, we are talking about women on the show again today, but not so much about women empowerment or women-led empowerment, rather. We're talking about the tedious health problems that women have to go through, and they don't necessarily have the time to talk about it because they're already swamped with so much work. So let's do them some good bidding. Let's talk about some health concerns specifically related to women. Let's break this down. Cardiovascular disease, CVD, is the leading cause of death amongst women in our country. According to the Global Burden of Disease, a study in 2019, cardiovascular diseases account for nearly 28% of all deaths in India, with ischemic heart disease being the largest contributor. Importantly, Indian women tend to develop heart disease about 5 to 10 years earlier than women in many Western countries, and that's something that we all need to take into account. We're talking about risk factors such as obesity, diabetes, hypertension, physical inactivity, and conditions like Polycystic Ovary Syndrome, the PCOS. They are rising sharply. Now, we've got some data from the National Family Health Survey 5, NFHS 5, between 2019 to 2021 shows that approximately 24% of Indian women, they're overweight or obese, and about 21% have hypertension. Increasing evidence from these studies suggests that women with PCOS have significantly higher long-term cardiometabolic risk, making early prevention quite critical. So, to speak about that and to decode all of that, with us are three top doctors. Many thanks for taking out the time, doctors. Dr. Arun, Kalyanasundaram, Interventional Cardiology, Chief Division of Cardiology, Promed Hospital, Chennai, India. Adjunct Assistant Professor of Cardiology, University of Washington in Seattle, United States of America. Well, many feathers in your hat, Doctor. Many thanks for taking out the time. Also with us on the broadcast, Dr. Sanjay Mehrotra, Senior Consultant Director, Cath Lab Services, Narayana Institute of Cardiac Sciences, Narayana Health City, Bangalore. With us on the broadcast. Many thanks for taking out the time, Dr. Mehrotra. And Dr. Vishal Rastogi, making up our esteemed panel. Somebody who's an interventional cardiology specialist, director of cardiology at Fortis, Okhla. Many thanks for taking out the time. Let's get the snowball rolling here, Dr. Kalyanasundaram. You know, why is women's heart health such an urgent topic today? We've mentioned some of those statistics from, the NFHS 5 survey, but talk to us about why it's important that we not only speak about women-led empowerment, but also talk about some diseases that women are going through and why it's such an urgent topic even in 2026.
First of all, I'd like to thank you guys for bringing this important issue to the forefront. And that was a great introduction done by you, Kabir. So let's talk about why, right? So let me just start with a small story. Like just recently, I had a 38-year-old woman who had actually presented to the ER with fatigue and jaw pain. And we although she's a female, thankfully, we had checked an ECG, some biomarkers, etc. And lo and behold, she just thought she had overworked because she was just fatigued. She actually had a heart attack about 6 hours before, and she just didn't know. You very correctly pointed out that heart disease is the #1 killer of men and women, not just globally, but also in India. And traditionally, the unfortunate thing is that heart disease is always known as a man's disease, but women also are very susceptible to it. We have and you also mentioned this, right? About 5 to 10 years earlier on, women tend to have disease in South Asia compared to the rest of the world. So this is true not just for men, but for women too. We have umpteen reasons for this, including some of the metabolic diseases, which are much more prevalent, diabetes specifically, in India. A lot of females are underrepresented in clinical trials. And so where we get the data from, which is typically your Western-driven data, even they're disproportionately represented by men and not women. So it's almost a systemic issue. And of course, on top of that, we have societal challenges where women tend to like kind of put things on the back burner and take care of the family, et cetera, et cetera. So, that's another factor. And then, of course, the most important thing I think is, and we'll kind of touch upon this later perhaps, is that women tend to have more atypical symptoms, not always the classic clutching the chest and having sweating, etc. This woman just had fatigue, right? Unusual fatigue. And also remember, estrogen gives you some protection early on, but around perimenopause and postmenopause, they quickly catch up to men in terms of risk and mortality from cardiovascular disease.
You rightly pointed out those pertinent points. It seems like data is not as robust. Dr. Sanjay Mehrotra, let me come to you. Let's pass the baton. How common are cardiovascular risk factors amongst Indian women? Could you name some of them, some of the viewers on our webinars? And of course, the audience questions are going to soon be with us. I'm going to put them to our esteemed panelists. But, if you could put some, point out some common cardiovascular risk factors, especially amongst Indian women.
So thank you again for inviting me to communicate with you guys on this platform, talking
Always
about
a pleasure to have you with us, doctor. Always a pleasure.
Women health. And, the predisposing risk factors, as Arjun talked about, is, of course, early onset of diabetes, hyperlipidemia, early onset of hypertension, and, of course, a diet which has become extremely, I would say, abnormal in our country. Not only our country, I think it's a global problem.
Yeah.
So those risk factors, which used to be not common, say 40 years ago, have led to increase in not only in men, but increase in the incidence of diseases in women as well. And I think today's topic about polycystic ovarian disease, which leads to increase or enhance atherosclerosis, causing, early onset of coronary artery disease, early heart attacks. And it all boils down to, specifically today's topic is a lifestyle which has led to this problem. Lifestyle which has led to more diabetes, lifestyle which has led to more obesity, and the kind of food which we eat is responsible for that. Of course, the Gen Z or whatever you call the current generation, where diet has become more and more processed. Diet has become more and more less and less organic. We don't cook, and especially young people don't cook. They usually, buy food and quick bite, and diet which is rich in carbs has led to early onset of insulin resistance, early onset of diabetes mellitus. And of course, these are systemic diseases with obesity lead to early hypertension, hyperlipidemia, and that causes the early atherosclerosis, leading to the complications and early onset, of course, heart attacks and then complications. So it's not surprising to listen what Arjun talked about, 38-year-old lady, which we never thought in our times when we were students. It's very uncommon for a young lady to come with a heart attack. But we see more and more menstruating women, working women being obese, being hypertensive, with either impaired glucose tolerance or diabetes, coming with heart attacks.
You see, that's another problem, because we constantly talk about how younger and younger women are having to go through this, and it's just a sad reality that women still put everyone else's health before their own heart. And, that's the kind of cultural ethos that we all, grow up in. Dr. Rastogi, come in on this. Are younger women, the urban women, are they facing these heart diseases more sooner than, let's say, older women? Indian women developing heart diseases at younger ages. And that's something that we need to throw some light on as well.
Yeah, first of Kabir, I must thank you for bringing this important topic to the forefront. And in fact, this is the case, as has been highlighted by the previous two speakers, that the Indian population, Southeast Asian population is generally at higher risk of having heart diseases. In fact, we develop heart diseases up to 5 to 10 years younger than our Western counterpart, and females are no exception to this. There are various reasons to this, and one of the most important reasons is probably genetic predisposition, and we can't do much about it, and it is there, and we are genetically predisposed to have disease earlier. But other than that, the urbanization and the other risk factors which have been mentioned are also very, very important. And so is important the special problems of insulin resistance, which is very common in Indian females, the problem of obesity, the problem of visceral obesity especially, and the early onset diabetes. So these problems, they compound the genetic issues and other factors, environmental factors, and that leads to the occurrence of disease which is earlier, which is atypical, and which is many times missed and underdiagnosed. So that's a multifold problem, and it should be recognized so that it can be treated in time.
Yeah, important points that you've raised over there. And, Dr. Mehrotra pointed out earlier that, diet is so processed these days, and you can't really blame that. So essentially, you've got the genetic predisposition, which has sort of loaded this gun, and your diet and lifestyle factors is sort of pulling that trigger. But, the other problem that, Dr. Kalyanasundaram, come in on this. The other problem that we're dealing with is that, I'm just tired, quote unquote. This symptom is often ignored for years on end, and we're normalizing with our lifestyles, how Indian households really work. We're normalizing symptoms that shouldn't really feel normal. So we all know women are special beings. Do heart attack symptoms differ in women?
Unfortunately, yes. So if you look at it, men tend to have more what we call typical angina, where you feel a chest pressure, they clutch onto their chest, etc. Women many times could have they just sit down because they're profoundly fatigued or tired, so to speak. They tend to have more shortness of breath, extreme fatigue, nausea, so where you want to throw up. And you have jaw pain, neck pain, back pain, shoulder pain, arm pain, or they just think it's heartburn, so indigestion-like pain. So typically these symptoms, many of us will, when you experience it, you tend to say, this just doesn't really sound like the heart. So these symptoms are atypical, and so, women can, just like it happens to men, right? You think it's not the heart, so you tend to ignore it or put it off more. Okay, so first they have atypical symptoms more. The second problem is the societal stuff that we talked about. The third problem is even if you go to the hospital, right, and you tend to go later, but even there you have less aggressive early intervention. And this has been shown, unfortunately, it's not an Indian problem, it's a global problem. We talked about the clinical trials, but it is also true that women get less aggressive treatment in the ER. Now, if a woman describes chest discomfort, let's say, she's more likely statistically to be evaluated for anxiety or GI issues or, stomach issues before cardiac issues. So it's like, I think just putting it out there is so that at least we know that this bias exists. And there's one other thing, which is kind of interesting. It's called MINOCA, myocardial infarction with non-obstructive coronary arteries, meaning there's no major blockage that you can see on an angiogram, but you've had a heart attack. This, again, is more common in women, and it is not without consequence. And sometimes when this happens, people are told, hey, it's just anxiety, right? So that's a diagnostic blind spot. So, yeah, it's the key message is be vigilant. Any new unusual symptom, don't blow it off.
How much more vigilant does one have to be? You're saying sometimes they don't even show up or come up on the angiogram. So what other tests, can women go after?
So again, that was a zebra. So I don't want people to say, okay, my angiogram was normal. So that is one entity that is more common. But typically, right, an angiogram is still considered, I would say, the gold standard for evaluation of coronary artery disease or ischemic heart disease, as we talked about earlier. But the point is, sometimes rather than the bigger vessels, they can have small vessel disease, etc. But that's usually a diagnosis of exclusion. So let's not get too distracted by that. But the key point is new unusual symptoms that occur, don't ignore it, right? Seek medical attention sooner than later, especially if you have a metabolic predisposition, if you smoke. Again, unfortunately, women smoke in India too, so don't smoke. If you have any family history, if you have any red flags, any predisposing factors, and sometimes you just don't know because you've never gone to the doctor. I mean, I'm sure each of the doctors here will tell you countless stories where people said, I'm fine, right? And then when you actually go to the hospital, it's like you're breaking bad news one after another. It's like, oh, by the way, you are a poorly controlled diabetic. You just didn't know that your hemoglobin A1C is 13. And I mean, people sometimes, unfortunately, live in blissful ignorance.
Yeah, you're absolutely right. Blissful ignorance versus confusing fitness with actual heart health. You see a lot of, gym goers that are dealing with these kind of heart ailments. They just don't know about it yet. So annual checkups, why are they still feeling optional? And I think that's why we're talking about this. For most women, it shouldn't feel optional. Annual checkups are very necessary here. All right, then, let's shift our focus here. Dr. Mehrotra, let's turn the spotlight on PCOS, Polycystic Ovary Syndrome. How does that come into the picture? How is PCOS connected to heart health?
So the polycystic ovary disease is very common. It's also called as a lifestyle disease, and the most common cause for that also is insulin resistance. Now, what do you mean by insulin resistance, and what is hyperinsulinemia? So, and I think the cause can be discussed here, and that is probably repeated eating of energy, glucose-rich food. So if you look at people in India, they start eating early morning tea with sugar, with a biscuit, or a coffee with biscuit, or some kind of a bread. Breakfast, which is rich in carbohydrate. Again at 10 o'clock, some coffee, tea with simple sugars. And then lunch again, very rich in carbohydrates. 70 to 80% of their nutrient value comes from the carbohydrate. Again, 4 o'clock, 5 o'clock, one coffee, tea with biscuits, or some kind of a patties or maida diet, which is very rich in maida, is almost like sugar. And then again one dinner, and again one sweet in the night. So how many times have you eaten? 7 times. 5 or 7 times. So when you eat again and again, every time you eat simple sugar, there's an insulin spike which happens. And the insulin spike is, you have enough. The purpose of the insulin is to put glucose inside your cells. Now, unfortunately, all our cells are filled with glucose. They don't need glucose. So what happens is this insulin, which is responsible for pushing the glucose into the cell for the cell metabolism, because glucose is your fuel for producing energy. Now, this cell, or all the cells of the body, which are filled with glucose, don't need glucose. So what does it do? The insulin becomes lipogenic. It converts itself, the glucose gets converted into the fat. And where does the fat go? The fat goes into your belly. And that's why the visceral fat, that's why the central obesity, that's why you see rounded faces of people. So that's subparotid fat. So this glucose, which has now become converted into fat, and the insulin has become ineffective. So the pancreas will secrete more and more insulin. The insulin is of no use. It is in abundance. So first of all, you exhaust your insulin-secreting gland, which is pancreas, and the insulin is not working. It is causing, and that insulin, which is more in your blood level, causes a direct effect on the ovaries. So the follicles, which are the precursor of the ovulation, don't mature. There are multiple follicles, and they become cystic. That is why it's called polycystic. And the ovary, the insulin has an androgenic effect. What do you mean by androgenic effect? Androgenic effect means that the women will lose the estrogen, and the luteinizing hormone goes up, and these androgenic hormone, which is like male hormones, would not allow the ovulation to take place. So what will happen? They suffer the sterility. So 70% of the polycystic ovarian disease would have insulin resistance, and they will have infertility. They may have hair growth, they may have acne. So that is polycystic ovary disease. And you will see a young lady, which is about 30 years of age, coming with no menstruation. It's very common for ladies to not menstruate. And also our menarche, which is the first onset of menstruation, has become 7 or 8 or 9 years of age. I don't remember when I was studying, we see polycystic ovary disease, but you see it all the time. So it's a lifestyle disease caused by insulin resistance. It is not an association. Actually, the insulin resistance, hyperinsulinemia.
Yeah.
Hyperinsulinemia directly affect the thecal cells of the ovary, causing the follicles to not mature. When the follicles don't mature, there are multiple of them, they don't ovulate. So the ladies don't ovulate. That means when they don't ovulate, there is no menstruation. So you miss periods. So they're associated with infertility. And they all have central obesity, visceral fat. So polycystic ovary disease is a lifestyle disease. Again, the mechanism is same, which is accumulation of visceral fat associated with central obesity and also insulin resistance or hyperinsulinemia, which means their circulating levels of insulin in blood are higher. Why does it happen? Because we eat energy-rich food, which is very readily available. All the time eating carb-rich food, and that's the cause.
Eating carb-rich food. I mean, that's so complex that you've told me about this. I remember when I was in college, several of my, friends were talking about PCOS, and I think this is another learning curve, not just for me, but all the other men that are probably watching this webinar as well. It's not only about the women, it's about how we can help our women in our respective households. So a carb-rich diet, unnecessarily pushing down, heavy glucose diets during the day can push us into the realm of dealing with these PCOS, issues. Yeah, Dr. Mehrotra, please complete your thoughts.
The other thing is that unfortunately our wheat and our rice, which are very, very processed, also have become almost equal to sugar. The glycemic index of wheat is actually more than sugar if you check it. So the germ layer of the rice has been changed, the germ layer of the glucose has been changed because they've been altered. 30 years ago, what wheat you had, you don't get that wheat anymore. The wheat doesn't have the germ layer, the wheat doesn't have the protein in it. So it's become totally almost like you eating sugar. So I don't want to talk about too much about where we get the sugar from, but unfortunately, the sugar industry has allowed...
It seems like we need to go back to our roots. So much of fast food, so much of, applications on a mobile phone, so much of, processed content that we're constantly consuming. Dr. Rastogi, let's talk about young women again. Young women with PCOS, I'm again reminiscent of my college days. I was ill aware back then, probably did not give it enough thought when my other friends were talking about PCOS, and it seems like it's so complex. Young women with PCOS, should they be worried about heart attacks? Is that something that goes hand in hand? If you have PCOS, you're a young woman, you're bound to get a heart attack. How does one decode that?
Yeah, so if somebody has PCOS, that means they have higher preponderance of androgens, that means the male hormones. So as Arun said earlier, females are usually protected because of the hormones they have. But if they have PCOS, then they have higher androgenic hormones and less estrogenic hormones, which means that they have higher risk of getting heart diseases. Unfortunately, this problem is compounded by other things which have been highlighted so well by Dr. Mehrotra also, that these patients usually have insulin resistance, they have early onset diabetes, they have obesity. So this problem is going to persist if we don't take care of it. And it's not as if somebody is diagnosed with PCOS and they will have a heart attack. It's not a direct relationship. But because all the risk factors are same, PCOS is not just it's not a problem of the less ovulation or a fertility, but it's also a metabolic problem where these metabolic factors are same, which are a risk factor for heart diseases also. So these patients are prone to have heart diseases because of this reason, that they have the preponderance of all these risk factors. So it is very important that patients who have been diagnosed with PCOS, they should take care of their other risk factors. So they should check their blood pressure, they should know their numbers, they should check their glucose very frequently because they are likely to develop diabetes sooner or later. They should take care of their lipid profile, and also they should monitor their weight, and they should lose weight so that the overall body profile can be more favorable for, it can be, we can have less risk factors for heart disease.
So you're saying they should know their numbers. We're talking about regular screening. We're talking about continuous blood tests, and the key is, of course, early intervention. And there needs to be a playbook over here, isn't it, Dr. Kalyanasundaram? If you could give the women out there a certain playbook that they could, go by, that they could live by. What role does lifestyle play in prevention, and what are your tricks and techniques that you, as a specialist, give to your own patients?
I'm glad I got this question, because what I'm about to say is true for men, women, non-binary, whatever, right? So this is super important, right? The only thing that you as a patient, or me as a doctor, or any of the other esteemed panelists, anyone can do for you that is absolutely risk-free is lifestyle changes, right? So this is foundational. It's the core. It's the no risk proposition. So what does this entail? I mean, I think we've talked about diet. So let me just give you my 2 cents on that, because it's super important. I think reading food labels is an essential skill set we all ought to have.
Very
Just
true.
because something is marketed as, oh, this is heart healthy, heart friendly oil, this, that. I mean, again, that's marketing, right? I mean, you need to be sure you have the skill sets to understand what each ingredient there is. Okay, that's number one. Number two, stop ordering stuff all the time from outside. Learn to cook, and ensure that your partner, even if you're a female, like the guy should. I think today's day and age, we all should be able to cook, right? Because we know what we put in. When you order out, it should be far and few between. And again, less processed. I think we've talked about that. So switching gears, you have to be physically active, right? We all sit way too much. The human body, male, female, we were not designed to sit for this long, right? Sitting is bad. So keep moving. If nothing else, and I'm sure people have stressful jobs, they have desk jobs, IT, high stress, etc. But you can, besides the exercise, which is like, what is recommended is at least 150 minutes of moderate exercise every week. You should also, every day, every hour, get up and walk around like, we all have smartphones, so just set a timer and like every hour, just get up, walk. It freshens your mind. It's incredibly helpful for the human body, right? And you can do simple things like the non-exercise activity. Park your car further out and walk. Take the stairs. Every hospital says take the stairs. Such things, right? And then the other, we don't talk about this much, especially for women. I think strength training is important, at least, twice a week. Focus on that. You're not going to get unfeminine by, getting some muscles. Muscles are super. They act as a buffer against, your insulin spikes, etc. So people should have muscle, and you lose muscle mass rapidly after the age of 40, men and women, right? And then 2 other things I think, especially these days, we see is everyone's like stressed out. So you need to have things to, your own techniques, whether it's yoga, dance, meditation, whatever it takes, man. Whatever reduces your stress level is very important. Along those lines, social connections. We're not talking about we're not talking about social media followers or connections, but like meaningful, real, where you can actually sit down and talk, like whether it's family, friends, etc. And for women especially, like I think it's important you have your own circle network that you can kind of chill out with, where you're not burdened by all the domestic stresses that you have. And the final piece, sleep. We take pride in saying, oh, I don't need to sleep, man. I got it. 4 hours. I'm good. I'm a rock star. You really should aim for 7 hours at least, 7 to 8 hours. And women generally need a little bit more sleep than men. So gentlemen, if you're watching it, let your partner sleep a little bit longer. It's okay. And early to bed, early to rise. We all learned this as kids.
Yeah.
Actually, even if you get 7 hours, sleeping post midnight and waking up late is not quite the same as sleeping early, like, by 10:30, and then waking up. So it's better to sleep early, get your 7 to 8 hours, wake up rested, and, carry on with life.
All right, pertinent points. Early to bed, early to rise makes a man healthy, wealthy, and wise. In this case, a woman. But how often do we really live by that? You spoke about smartwatches. I mean, doctors, are smartwatches now becoming smarter about our own hearts than we actually are? And another problem that I deal with is that people have become aware. They're counting their steps all the time. Dr. Mehrotra, how about you take this one? They're counting their steps all the time, but is the step counter replacing actual and real fitness? Before we talk about the importance of screening, especially in tandem with PCOS, the step counts. People are saying, okay, I got 10,000 steps, nothing, I'm untouchable now. I sincerely believe that's not the case.
No, I agree with you. I don't think that we should worry too much about our step count. I think it's more important to put in certain time of specificity. See, the exercise is a leisure time activity, not while you are working. That doesn't mean anything. You need to do exercise for the sake of exercise. And as Arun said, that if you sleep early, then you have a time in the morning, which is a very important time for any human being. Because if you sleep late, which is most of our youngs do, you get up late, your circadian rhythm is gone for a 6. You work in the night, you're not exposed to the sun in the time. See, we're not human beings which are away from the cosmos. We're part of the cosmos. We have to live with the circadian rhythm. So it's very important to have the circadian rhythm intact. And it's very important to exercise. I would say 150 minutes per week is not enough. You should exercise at least 30 to 40 minutes per day. And
wow, thanks, doctor. I was here feeling good about myself that I'm doing way beyond 150 minutes per week, but now you've busted that myth as well.
No, you should do more. You should do more. At least, and some kind of strength training is important for all human beings, because when you use your muscle, you reduce the insulin resistance. That's very important. How to counteract whatever we are doing. And as we said, the food which you eat late, there is a direct relationship between growth hormone and insulin. So when you eat very late, when you don't rest, your insulin is secreted when you eat. So suppose you sleep at 10 o'clock and you've eaten food at 9:30 and you go bed by 11:30, you are actually not rested. By the time you go to bed, the insulin will rise and the growth hormone will not come. The growth hormone in adults or grown-up individual is required for maintaining the body. Hemostasis of the body. So there is an indirect relationship between growth hormone and insulin. So you don't repair your body if you have eaten very late. So it's very important to eat early and don't eat a very carbohydrate-rich diet and sleep at least 3 to 4 hours later. And when you sleep, for at least 7 hours, you have had a spike of the growth hormone. And the best time for the growth hormone is to go up in the morning, especially when you exercise in the morning. The growth hormone
That's really
goes
great
up.
to hear, doctor. I'm here thinking, I have a show to do at 11 p.m. tonight. How am I to sleep at 11 and, then consume my dinner before that as well? The most I can do is probably have my dinner at 9:45, 9:30 and hope that I go back home and crash straight into the bread.
That's an occupational hazard. Hazard. You have to give some.
All right. So for all the women out there, and I know there are some women anchors as well, there are lots of ladies on the news desk here that are preparing those late night shows. What's your word of advice for them? I see all of them going for their dinners at about 9:30. Some people having their dinners at 10 o'clock also. I don't know what time they actually sleep when they go back home. But for somebody who's had their dinner at, let's say, 9:30, 9:45 p.m., what do you suggest happens next? Somebody who's had dinner at 10 p.m., when should they then go off to sleep? Because sleeping instantly after dinner, I've heard, is equally bad as well.
Well, I mean, it's a very difficult compromise to make in somebody's life who works because of a professional requirement late in the night, eats late, and then gets up early, and then he has a lot of things to do, which is late in because you people work in that part of the profession that you have to work in the night. So my understanding would be that you should not eat very late. Even if you sleep late, don't eat very late. Finish your dinner early. Finish your dinner. You finish your dinner by 7:38. You may be able to sleep by 11. But if you've got about 6 to 7 hours of sleep, you can get up at 6 o'clock, go for a walk, and then delay. And the fasting is also very important. You should get the long gaps of fasting because fasting regenerates your body. So if you eat, say, 10 o'clock and then you eat again at 6 o'clock, there is no fasting.
Yeah.
The breakfast is designed to create a 12-hour to 14-hour of fast. The fasting is the very important part. That is why, that everybody talks about intermittent fasting. So I would say eat early. Don't eat after 8. But you can sleep whenever you can. And you probably try to not become every day the same pattern. That is a problem if it becomes a pattern for every day. So you
And
need
if
to
it does become a pattern, then you need to understand the cosmos and then find your own circadian rhythm. That's again, quoting Dr. Mehrotra here from the show. I have a question for you. And Dr. Arun, I saw you raising your finger as well. But let's bring in Dr. Rastogi as well. I'm sure he has some credible insights on this particular front. What's your take, Dr. Rastogi, before we go into the normal questionnaire?
No, so it is very, very important that we eat in time. So unless until we eat by 6 or 7. So, this has been there for Indian tradition for very long. The Jain dharma says that they don't eat anything after sunset. And if you follow that, then all your acidity, gas, your fullness in the tummy, that will have immediate benefit. We are talking about long-term benefits. We are talking about heart health. But if you start doing it, you will feel the benefit immediately. So all these patients who come to me with gas problems, I just suggest one thing to them, that they should eat early and sleep in time. And of course, if sleeping in time is not possible, as highlighted, that because of your profession or your commitments, then still you should eat in time, take your tiffin with you, eat in time, and then sleep for at least 8 hours. That's absolutely necessary.
All right, we hear you. Dr. Kalyanasundaram, your word of advice, and then we'll get back to the normal questionnaire.
Yeah, this was kind of an interesting detour, but a couple of things, right?
Yeah.
The first thing, in fact, I kind of did and again, this maybe a lot of our viewers already know this, but the 10,000 steps actually came out of a Japanese marketing campaign. Okay, so but there are studies that show that more steps are generally good, but I think 7,000. If you can hit that overall, it's a pretty good thing. So we do need to move, but don't get dogmatic, and don't obsess about it. If you're not meeting a certain metric, it's okay. I think it's more important. It's like, it's a marathon, not a sprint. So one day you got a busy day, you couldn't do it, don't obsess. You asked about smart watches earlier. Yeah. I think it gives a lot of interesting metrics these days. So I think going along with and by the way, completely agree with everything Dr. Sanjay Mehrotra and like Dr. Vishal Rastogi had said. But like, the whole idea about eating late, what it can like sometimes do, and if those that have smartwatches that can measure heart rate variability, etc., which is an important predictor of how well you're going to live and how your heart health is. You eat late, your HRV or heart rate variability sucks pretty much the next day when you look at it. So eating early is super important. And I think what Dr. Vishal had said about like, our ancient stuff, like, stop eating after sunset. So it's a very good thing if you can actually follow it. And it also, like, while you guys were talking, it just reminded me about the whole thing, right? Front load your your calories. So there's this saying like, eat your breakfast like a king, your lunch like a queen, and your dinner like a pauper. So again, unfortunately, life gets busy. You might have to do a late night stuff. I mean, we have to go sometimes in the middle of the night to do cases, whatever, right? We don't have complete control over that because of the way the world is. But what you can control is when you eat and what you eat. So I think those are all like, super duper important things that I think you can just incorporate. Oh yeah, about the smartwatches stuff. I also want to say, don't obsess about it, right? Like it's okay. Use it as a rough metric, collect the data. Of course, I'm sure the bigger companies are also collecting the data, but it's more for you to have some kind of a, internal feedback, monitor it, but don't worry too much about it.
Okay. All right. So don't obsess over the smartwatch metrics, but we do need to take a look at the screening process. Dr. Sanjay Mehrotra, how important is screening in women, especially those with polycystic ovary syndrome?
See, in the process of preventing disease, it's very important to detect early. So it's important that you get your test done, detect early, so that you can make the progress of the, suppose you do find some disease early, say 30 years of age, you become a bit more aware about that you have some problem, you have to be more committed to your problem. So I think the early detection is very, very important. And then fortunately, or unfortunately, I think I rely more and more on the CT these days, even just a calcium score in young people, CT coronary angiography, which I would say is become a very important tool not necessarily what we used to call an intermediate risk, even in the low risk with a strong family history, PCOD, I would suggest that we should try to screen and find out we don't have coronary artery disease. We don't have precursors of disease in our bodies, impaired glucose tolerance, check every day, and especially if you're obese, viscerally fat, or centrally obese, and you have some problems which are like PCOD, you need to be very, very aware about. You keep your cholesterol under control, you keep your blood pressure under control, don't lose your weight. And as we have already discussed, nothing beats lifestyle modification. Our lifestyle is the problem. That's why we have more disease. All the diseases, diabetes, hypertension, early onset of coronary artery disease, endothelial dysfunction, which we have not talked about so far, PCOD, they're all part of lifestyle diseases caused by nutrition, predisposition, genetic, association with stress, and of course, as we said, stress which goes on while sleeping also. So if you don't sleep well, obviously you're going to stress all the time. So it's a very multifactorial disorder. It's not a single pointer. And all these things you have to detect early so that you can avoid progression or treat early when possible.
You're absolutely right. I was reading up on Ayurveda, what is a healthy body? It's actually the combination of all these things that, doctors, you've very fantastically put on the table. But when we're talking about, PCOS, we're talking about fertility issues. Dr. Rastogi, we need to touch upon pregnancy as well. So pregnancy complications, vis-a-vis, propensity of future heart disease. Break that down for all the women viewers that are watching this webinar right now. Pregnancy complications linked to future heart diseases.
Yeah, so pregnancy is something which is again very unique. It has multiple changes. It brings multiple changes to a female's body. So they have a lot of volume overload. They have swelling, and they are prone to have certain diseases during pregnancy. And many times these diseases are missed if we are not specifically looking for them. A very specific problem that these female patients may have is peripartum cardiomyopathy, in which condition the heart becomes weak and they start feeling breathlessness, they start having swelling of the legs, and it usually occurs during the time of delivery. So at that time, as such, these female patients, they have bloating of legs, they have stomach full, and the uterus, which is bulky, is pressing on the diaphragm. So the breathing may be difficult. So many times they just take all these symptoms as the natural symptoms of pregnancy, while it may actually be a very sinister disease. It may actually be a big problem, which has very high risk of complications, not only at the time, but also in future life. So peripartum cardiomyopathy, where the heart becomes weak, is a very serious problem, and that actually may culminate into heart failure later on. The other problem is that these patients may have gestational diabetes. That means the glucose insulin resistance become more pronounced during pregnancy, and these patients are prone to develop hyperglycemia during the phase. And sometimes this gestational diabetes carries on, and these patients continue to go on to become frank diabetic later on. Also, hypertension or preeclampsia, which is a very specific problem where the blood pressure shoots up during pregnancy, and if not treated in time, that can lead to very serious loss of child as well as women health hazard. And that also, these patients sometimes carry on this blood pressure at the later life also. And these patients who develop these complications, they have definitely very high complication rate to develop, to go on to have more heart diseases later on.
So it is certainly complex, but it all can be mitigated if you keep your life in check. Of course, early screening also helps, and all those points that you've made out. It has been a riveting conversation. I know it can be boring for all of you doctors to talk about it again and again. It's like, the math teacher trying to solve the same 2 + 2 for the student and asking for all those silly questions again coming up to the blackboard. But many thanks for taking out the time and speaking to us here. The final 10 seconds, if I could close this show with, Dr. Kalyanasundaram, the final playbook. What would be your message to all the audience members, to all the women that are watching this webinar right now? Just a quick closing thought. All cameras on you.
Okay, so great show. Again, importantly, I just want to emphasize that heart disease is the #1 killer. Your symptoms can be atypical. Ensure that you get checkups. Focus on your lifestyle. Focus on you. Self-love, I think, is really important. Take ownership of your health. And I think even as the medical community, we need to be more cognizant of the fact that there are differences in how men and women are treated. And I think
Yep.
as a system, we should strive to make that better. But yeah, so stay healthy. Women are they are like the anchor of the family. So it's important that you are healthy so that the family is healthy.
Backbone of the country. I mean, if I could put it in a more technical term, backbone of the
Yep.
entire GDP of the country. That's what women are. And we've been constantly talking about women empowerment, not just women empowerment, women-led empowerment, and now we're talking about women's health as well. We'll leave it at that. Many thanks for taking on the time, doctors. Dr. Kalyanasundaram, Dr. Mehrotra, Dr. Rastogi, always so fantastic to have you with us here on TV9's a special initiative where we talk about Samajhdar bano, sehat ke ishare samjho. So your heart is not waiting for a warning. It speaks in signs long before a crisis. If you act early, if you pick it up soon, you can prevent it. And prevention today is going to be the difference between loss of life later on. We're going to leave it at that. Many thanks for watching. We're going to keep coming with these webinars as well.